Hello, my name is Brianna Ricks, and I'm here to talk about my service learning project that I did for my health agency management class. So, I was fortunate to do my service learning project with the American Heart Association here in Virginia. And what's interesting is that I actually work for the American Heart Association, but I was blessed to be able to expand a little bit more on the community service aspect of things when it came to the American Heart Association. So, just a little bit more about my role at the American Heart Association. I serve as the Community Impact Director for the area that I serve, and that involves creating various community programs to kind of really promote health, to promote healthier outcomes in the community. So, some examples of some things that I tend to do in the community is I work with different clinics to try to make sure that they have blood pressure cups that patients can take home with them so they can, monitor their blood pressure at home. So in the event that it's high, they can, seek, the proper care. So that's just an example of some things that I do in my everyday work with the American Heart Association. And you'll see how that all ties in together as I talk through this presentation. So I was able to work with a couple of different individuals. I really, really enjoyed working with individuals of different backgrounds, and I'll speak more to that towards the end of the presentation. So, with this service learning project, I was able to work with two different nurses who, interestingly, I didn't realize until I started working with both of them and comparing them that they actually have the same background. They both have a doctorate of nursing practice. So they're nurses, and my background is not clinical. Well, I have a little bit of a clinical background, but definitely not as much as a nurse. So it was definitely interesting to get their insight on things. My executive director, she also has a background in health promotion, but different from me. She focuses specifically on the health communication aspect of health promotion. So that's kind of how we really communicate any health promotion tactics to the community. That's really what her specialty is. And I also was able to work with a lovely chef who was responsible for preparing the healthy meals for our cooking classes, and I'll talk a little bit about that momentarily. So the first thing that I want to talk about is how I was able to really understand and kind of work through the core competencies of public health. So the first one that I really exhibited a lot of the time was analytical and assessment skills. So I previously, a couple of months ago, I did complete a needs assessment for the American Heart Association, and I was able to use that needs assessment and determine what types of participants I needed to recruit for the healthy cooking classes. So these cooking classes, they are heart healthy, so we wanted to really recruit those individuals that needed to learn how to cook better for their heart, of course. And of course, based on the needs assessment that I had done previously, I knew that there were a lot of individuals in Hampton Roads that suffered with hypertension. Our rates of hypertension in this area are extremely high, and that was something, clearly there was a need there when it comes to high blood pressure. So when I was speaking on the phone with participants, I definitely tried to make sure that they had some form of hypertension or maybe had a family member in the family that was suffering with hypertension and wanted to learn how to better manage that condition through diet and lifestyle changes. Secondly, communication skills, core competency, that was something that I wasn't expecting to run into, but what I noticed as I was recruiting these individuals for the cooking classes, a lot of them did not know how to utilize Zoom. And of course, due to COVID, the cooking classes, previously, from what I understand, they were done in person before COVID. But since COVID came in, we had to pivot everything to a virtual standpoint. So a lot of them didn't know how to use Zoom, had never used Zoom before. A lot of them didn't even own a laptop, but they had smartphones. So I was able to kind of talk them through downloading the Zoom app, teaching them how to access the class from the Zoom app. All of this was over the phone. I was very proud of myself that I was able to do this. But I was able to do that, and I really saw how important communication is and ensuring that, participants and patients and clients in the community, especially your target area, and especially those that are, more vulnerable and, more underserved, how important it is to really work with those individuals so that they can access things like virtual cooking classes. So that was something else that I addressed that I wasn't expecting to. Moving on to another event that I was able to participate in at the Hispanic Resource Center here in our area, I was able to distribute information on hypertension and healthy cooking to participants at this event. They were actually doing COVID testing and getting flu shots. So, like I said, I was responsible for passing out information on high blood pressure and healthy eating, but this was the Hispanic population, so of course I had to make sure that the information that I was passing out, that they understood the information. Now, of course, how much sense would it make for me to give them information in English if they didn't speak English or didn't read English? That, really defeats the purpose, and, the goal is essentially crushed if, they can't access the information like they need to. So before the event, I made sure that any information I was handing out, all of it was in Spanish. Any recipes that I gave out, I made sure they were also in Spanish, and I even went a little further to include some, popular Hispanic recipes also. And that really not only made sure that they, were able to understand and comprehend the information, but that also created a sense of trust between me and that the particular clients that I was serving. So that was great also. And lastly, I was also able to connect with the Baptist Church, and that was important to me because, and it was also, part of the cultural competencies, not the cultural competencies, the core competencies for public health. That was important because I was able to make a connection with an organization that was not directly tied to public health and was able to access the population through that organization, specifically the African American population. They're very vested in their faith, and hypertension is very high among the African American population. So I was excited that I was able to make that connection with that church ministry. So the answer to the overall question here, as I believe I have a minute or so left, what makes a good collaborative team for public health? So my first thought on that would be ensuring that even if you have a team and you have individuals of different backgrounds like mine was, I believe that as long as you have a common goal in mind, as long as you all have the same goal and you're working towards the same thing, you're working towards better outcomes for individuals, I think that, it's good to have individuals of different backgrounds. And an example that I'll give is with me and the nurse. My background is specifically in community. Now, I've worked in a clinical setting, but nowhere near as much as a nurse has. I was more so in the community doing home visits, and I was able to see what individuals were experiencing and what was lacking in the community. And she's able to see, the clinical aspect and the effects of not being able to get proper medication. So we were able to mesh, what we, both had experienced in our background. So I was able to explain to her, how patients, how it's easy for patients to, well, not easy, but how it's common that sometimes patients have to make a decision between buying medication or buying food. And she was able to explain to me how going without a particular medication for a certain amount of time can be detrimental to a patient's care regimen. So I definitely think that having different backgrounds can allow you to provide different insights to someone else, and can also allow you to receive insights from a different background that you may not have experienced, but would definitely help you reach, like I said earlier, your common goal. So overall, I enjoyed doing this project, and I am looking forward to continuing on through my coursework. And thank you.